Hello, I'm Dr. David Thompson. And if you're joining me today, it's likely because you felt that painful, frustrating grinding sensation in your knees, the feeling that your life is shrinking with every step. Let me tell you about a patient of mine, Eleanor from Des Moines, Iowa. Eleanor was 62, a retired school administrator, and she came to see me 2 years ago. Not walking, but shuffling. Her condition was so severe, bone on bone in both knees, that her family was already researching the best assisted living facilities for her. She was terrified of losing her independence, of becoming a burden. She felt like her body had betrayed her. Her initial X-rays were devastating. Her orthopedist had already scheduled her for double knee replacement surgery. She told me, "Dr. Thompson, I just want to walk my dog around the block again without crying." But here is the miraculous part. Eleanor canceled both surgeries. Today, Eleanor is 64. She isn't just walking her dog, she's hiking light trails. She's dancing at her granddaughter's wedding. She is healthy, independent, and fully engaged with life again. What did we do? Did I prescribe a new, costly miracle drug? Absolutely not. The solution that pulled Eleanor back from the brink of a nursing home was a simple, yet profoundly powerful natural nutritional method, a way of eating that literally gives the body the building blocks it needs to repair and regenerate its own knee cartilage. It's a solution that 97% of conventional doctors usually overlook, choosing instead to manage symptoms with pain pills or scalpels. In the next 20 minutes, I'm going to guide you through this exact method. I will reveal 7 of the most potent natural foods that act like a construction crew for your knees, complete with the scientific proof, the exact recipes, and the golden time to consume them. I promise you, this information can change your life. Before we dive into these 7 life-changing foods, I need to know who I'm speaking to. So, right now, please do me a favor. Go down to the comments below and type your age and your single worst symptom. Is it a sharp, shooting pain? Is it the morning stiffness? Is it that loud crunching sound when you climb stairs? Comment below, age/worst symptom. I want to see your comments. It helps me understand the community we're building here, a community committed to natural healing. Now, listen closely to something revolutionary. Your knee pain is most likely not a simple result of just getting old, and it's certainly not a genetic curse. This pain, this breakdown of the cartilage, is almost always the result of a deficiency in 3 specific, yet critical nutrients. We'll cover all 3 nutrient groups as we go through the 7 foods. You can only start rebuilding when you stop the structural deficit. For those of you who are new here, my name is Dr. David Thompson. I'm a physician who has dedicated over 30 years of my life to treating thousands of patients using the power of science-based nutritional and lifestyle medicine. This channel is dedicated to one mission: to help you live your healthiest life, full of energy, independence, and vitality, well into your 80s and 90s, all by harnessing the incredible healing intelligence of your own body. We believe in science, we believe in nature, and we believe in your capacity to heal. Let's run a quick diagnostic. How many of these 5 common, everyday symptoms are you currently experiencing? Count them up honestly. 1. Morning stiffness. Do your knees feel locked up, requiring several minutes to loosen up after you wake up or after sitting for a long time? 2. Weather-related ache. Can you predict the weather because your joints ache when it's cold or damp? 3. Nocturnal pain. Does knee pain or a dull ache wake you up or prevent you from finding a comfortable sleeping position at night? 4. The popcorn sensation. Do you hear a distinct clicking, popping, or crunching sound, crepitus, when you bend or straighten your leg? 5. Difficulty with the first step. Is the very first step out of a chair or bed the most painful, but it slightly eases after a few minutes of walking? Okay, count the number of symptoms you checked off, and comment that number below right now. 0, 1, 2, 3, 4, or 5. If your number is 3 or higher, you are almost certainly battling what I call the unholy trinity of joint degradation. The root cause linking all these symptoms is not aging. It's a vicious cycle of chronic inflammation, oxidative stress, and poor circulation or ischemia. Chronic inflammation acts like a slow-burning fire, constantly dissolving your cartilage's structural proteins. Oxidative stress is like rust, degrading the delicate collagen matrix. Ischemia means the joint isn't getting enough fresh blood flow to deliver nutrients and remove waste. The 7 foods we're about to discuss are a targeted nutritional antidote to this trinity. Let's start the healing journey now. Solution number 1. The grandmother's secret, high gelatin bone broth. The first item is arguably the most fundamental and overlooked, a remedy our grandmothers knew, but modern medicine forgot. It is high gelatin bone broth, particularly made from chicken or beef knuckles. I remember Mr. Ben Carter, 71, who had a constant low-level throb in his right knee that made playing with his grandkids impossible. He was deeply skeptical of my food as medicine approach. After just 6 weeks of consistently drinking the broth I recommended, he called me, not to report a reduction in pain, but a complete absence of the morning stiffness. He could crouch down to pick up a toy again. He wasn't cured instantly, but the structural pain eased dramatically. Bone broth is packed with a key nutrient, type 2 collagen. When you slowly cook the bones, this collagen breaks down into gelatin and amino acids like proline, glycine, and hydroxyproline. These are the exact raw materials your chondrocyte, your cartilage-producing cells, need to synthesize new cartilage. Think of it like a construction crew getting a sudden, massive delivery of high-quality bricks, the amino acids, right to the job site. It also naturally contains glucosamine and chondroitin, which act like internal joint shock absorbers. A study published in the Journal of Bone and Mineral Research, 2018, demonstrated that the daily intake of specific hydrolyzed collagen peptides, the broken-down form found in broth, significantly increased the density of cartilage and connective tissue, directly supporting its role as a building block for joint regeneration. Practical guide: how to. Recipe: use knuckles, feet, or joints for maximum gelatin. Simmer for at least 12 to 24 hours with a splash of apple cider vinegar to draw minerals out. Dosage: 1 large mug, approximate 10 to 12 ounces, every morning on an empty stomach. Notes: consume it warm. Avoid adding highly processed seasoning packets. Focus on the slow-cooked natural goodness. Have you ever noticed how healing a warm mug of broth feels? Tell me, do you make your own broth, or do you buy it? Let me know in the comments. Solution number 2. The red powerhouse, tart cherries. The second food is a small, vibrant red fruit that is an anti-inflammatory powerhouse, tart cherries, specifically the Montmorency variety. Mrs. Diane Bell, 55, an office worker and recent postpartum mother, struggled with an aching knee that made sitting for long periods unbearable and getting up agonizing. The intense, sharp pain was an inflammatory issue. She started a daily tart cherry regimen. Within 3 weeks, her pain journal showed a 40% reduction in what she called her intensity level. The difference was enough for her to start light cycling again. Tart cherries contain an astonishingly high level of compounds called anthocyanins, specifically anthocyanin 2. These are potent antioxidants and anti-inflammatories. They work by inhibiting the COX enzymes, COX-1 and COX-2, the exact same enzymes targeted by over-the-counter NSAID pain relievers like ibuprofen. But, unlike the drugs, anthocyanins do this without the harsh side effects on your gut lining. They are, essentially, nature's nonsteroidal anti-inflammatory drug, NSAID, tackling the inflammation that drives cartilage decay. A meta-analysis published in the European Journal of Nutrition, 2019, confirmed that tart cherry consumption significantly reduced inflammatory biomarkers, including C-reactive protein, CRP, in multiple human trials, demonstrating its power in mitigating chronic joint inflammation. Practical guide: how to. Recipe: focus on unsweetened tart cherry juice concentrate. The whole fruit is great, but the concentrate is where the power is. Dosage: Mix 2 tablespoons of concentrate with water, twice daily, mid-morning and mid-evening. Notes: crucially, ensure it is tart cherry juice, not the sweet varieties, and avoid added sugars. Combining it with a source of vitamin C, like a squeeze of lemon, can enhance absorption. The juice is a bit tart, but the benefit is incredible. Have you ever tried tart cherry juice? What was your experience? Solution number 3, the lubricant master, avocado oil. Our third solution is a simple pantry staple, but its effects on the joint are revolutionary. High-quality, cold-pressed avocado oil. Michael, 52, a busy executive, suffered from the classic crepitus, the crunching sound, due to lack of synovial fluid, the joint's natural lubricant. He added avocado oil to his lunch salads daily. The change was subtle at first, but after 2 months, the crunch that embarrassed him on stairs was noticeably quieter. His joint felt smoother, not just less painful. Avocado oil is rich in monounsaturated fats and a unique compound called avocado/soybean unsaponifiables, ASUs. ASUs have been shown to help inhibit the catabolic effect, the breakdown, of cartilage by reducing the production of certain inflammatory chemicals, interleukins. Furthermore, the healthy fats act like a carrier to absorb fat-soluble vitamins critical for joint health, and it helps maintain the fluidity and function of the synovial membrane, which produces the vital joint lubricant. Think of it as relubricating the squeaky wheel from the inside. A review in the journal Rheumatology International, 2014, highlighted clinical trials showing that ASUs, derived from avocado and soybean oils, slowed the progression of joint space narrowing in patients with knee issues, indicating a protective effect on the cartilage structure itself. Practical guide: how to. Recipe: use it raw. Cooking at high heat destroys the delicate compounds. Dosage: 1 to 2 tablespoons drizzled over a salad, vegetables, or used in a dressing at lunchtime to maximize absorption with other food. Notes: always look for extra virgin or cold-pressed to ensure maximum ASU content. It's so easy to swap out a standard cooking oil for this one. What is your favorite way to use avocado oil? Share your recipe idea below. Solution number 4, the spiced cleanser, turmeric with black pepper. Number 4 is an ancient remedy that has stood the test of rigorous modern science. Turmeric, specifically when paired with its little-known partner, black pepper. My patient Grace, 68, was dealing with significant knee swelling and warmth, a clear sign of active, rampant inflammation. She began taking a high-dose turmeric pepper mixture. Her doctor noted a substantial decrease in her inflammatory markers during her next blood test, and she reported that the visible swelling was gone within 6 weeks. The superstar here is curcumin, the active compound in turmeric. Curcumin is a phenomenal anti-inflammatory, but its power lies in its ability to scavenge free radicals, those rust particles of oxidative stress. More importantly, it helps downregulate the NF-κB pathway, the master switch that controls nearly all chronic inflammatory responses in the body. Black pepper contains piperine, which has no joint effect itself, but it can increase the bioavailability, absorption, of curcumin by up to 2,000%. Without piperine, most of the curcumin just passes through your system. The journal Osteoarthritis and Cartilage, 2019, published a study confirming that supplementation with curcumin significantly reduced pain scores and improved physical function in patients, performing similarly to common NSAIDs, but without the side effects. Practical guide: how to. Recipe: a simple golden paste, made from turmeric powder, fresh cracked black pepper, and a healthy fat source like coconut oil or olive oil. Dosage: take half to 1 teaspoon of the paste with dinner. Notes: must be combined with a fat, coconut oil/olive oil, because curcumin is fat-soluble, and must include black pepper for maximum absorption. This is a medicine cabinet in a spice jar. Do you use turmeric already? What do you use it for? Solution number 5, the circulation booster, beetroot juice. We're moving from repair to transport. The fifth food addresses the issue of ischemia or poor blood flow. This is the beetroot, consumed as a fresh juice. I once worked with a retired postal worker, Robert, 65, whose knee pain was exacerbated by long periods of sitting and then trying to get moving, classic signs of poor joint circulation. He started drinking a small amount of beetroot juice daily. He noticed that the sharp, throbbing ache that usually accompanied his sedentary periods was dramatically reduced. The nutrients were now getting where they needed to be. Beetroot is one of the richest sources of naturally occurring dietary nitrates. When consumed, your body converts these nitrates into nitric oxide, NO. Think of nitric oxide as a master road opener for your blood vessels. It causes vasodilation, the widening of arteries and capillaries. By increasing NO, we can boost blood flow directly to the joint capsule and surrounding tissues. This means a faster, cleaner delivery of the cartilage-building nutrients, like those from the bone broth, and a quicker removal of metabolic waste. A study in the Journal of Applied Physiology, 2016, demonstrated that dietary nitrate supplementation from beetroot juice improved muscle oxygenation and blood flow, which is crucial for reducing pain and improving function in areas with poor circulation like damaged joints. Practical guide: how to. Recipe: freshly juiced beetroot, combined with an apple or carrot to temper the earthy taste. Dosage: 4 to 6 ounces of fresh juice, mid-afternoon for a sustained effect. Notes: start with a small amount. Beets can sometimes cause mild digestive upset initially. The juice is powerful. Have you noticed a change in energy or pain when you drink beetroot juice? Share your thoughts. Solution number 6. The cell regulator, wild-caught fatty fish. The sixth food takes us back to the sea, wild-caught fatty fish, specifically salmon, sardines, or mackerel. Jennifer, 50, who spent all day at a computer, had constant, low-grade knee aches and stiffness. She was low on a critical anti-inflammatory nutrient. We introduced fatty fish 3 to 4 times a week. After about 2 months, she reported that the internal buzzing of pain had simply faded away, allowing her to focus on her work and sleep better. The critical compounds here are the omega-3 fatty acids, EPA and DHA. These are not just good fats. They are the fundamental building blocks for anti-inflammatory cell signaling molecules called resolvins and protectins. They work at the cellular level to literally change the chemistry of your body, pushing the balance away from inflammation and toward resolution and healing. They act like a fire extinguisher for the chronic inflammation fire we discussed earlier, directly protecting the chondrocyte from inflammatory damage. The prestigious New England Journal of Medicine, 2016, has published numerous papers demonstrating the powerful anti-inflammatory effects of EPA/DHA, noting their ability to reduce the need for NSAIDs in patients dealing with chronic joint conditions. Practical guide: how to. Recipe: grill, bake, or lightly steam the fish. Dosage: aim for 3 to 4 servings of fatty fish per week. Notes: focus on wild-caught sources to ensure higher nutrient density and lower toxin load. If you cannot eat fish, a high-quality, third-party tested fish oil supplement with a combined EPA/DHA of at least 1,500 milligrams is a necessary substitute. Are you getting enough omega-3s? Which type of fatty fish do you find easiest to incorporate into your diet? Solution number 7. The mineral binder, dark leafy greens. Our final food is the foundation of health, but specifically for joint repair, it's about one overlooked vitamin: dark leafy greens like kale, collards, and Swiss chard. Eleanor, my initial patient, told me that once she added a consistent daily serving of cooked greens, she noticed her general mobility improved, not just her knees. The overall soreness and rigidity seemed to lift within a month. Dark leafy greens are rich in a variety of minerals, but their secret power for cartilage lies in vitamin K2, menaquinone. Why is this critical? Vitamin K2 plays a vital role in calcium metabolism. It helps ensure that calcium is directed away from soft tissues, like artery walls and joint capsules, where it can cause calcification and stiffness, and is directed toward the bones and teeth. By managing calcium effectively, vitamin K2 helps maintain the smooth, flexible nature of the joint structure and can help prevent the abnormal calcification that contributes to joint stiffness and pain. A study in the American Journal of Medicine, 2018, found that low intake of vitamin K was associated with a higher risk of developing osteoarthritis, underscoring its protective, regulatory role in joint health. Practical guide: how to. Recipe: lightly steam or sauté the greens with a healthy avocado oil, a perfect combination. Dosage: 1 large bowl, approximate 1 to 2 cups, cooked daily with your largest meal. Notes: cooking greens like kale or chard often makes the nutrients more bioavailable, and the necessary fat is essential for K2 absorption. This is a simple, non-negotiable step. How often do you currently eat dark leafy greens? Be honest. You've just received the complete, science-backed nutritional blueprint that restored Eleanor's independence and has helped thousands of my patients reclaim their lives. Let's quickly summarize the 7 cartilage-restoring superfoods. 1. High gelatin bone broth, the raw materials. 2. Tart cherries, the natural anti-inflammatory. 3. Avocado oil, the joint lubricant. 4. Turmeric with black pepper, the antioxidative cleaner. 5. Beetroot juice, the circulation booster. 6. Wild-caught fatty fish, the cellular fire extinguisher. 7. Dark leafy greens, the mineral regulator. My final advice is this: do not try to implement all 7 at once. That's a recipe for burnout. Pick 1, maybe 2, that resonate with you. The bone broth and the tart cherries are excellent starting points, and commit to them for 2 weeks. Then, slowly build from there. A gentle warning: consistency is everything. The body needs time to lay down new tissue. This is not a pill, it's a process. Give yourself grace, but commit to consistency, and you will see results. Your body has an astonishing capacity to heal, repair, and regenerate. All you have to do is give it the right tools. If you found this information valuable and you are ready to take control of your health and live independently, please hit the like button on this video right now. And most importantly, subscribe to this channel and turn on notifications. I have more life-changing, science-based health solutions coming next week, and you don't want to miss it. Thank you for trusting me with your health journey. I look forward to reading your success stories in the comments. I'm Dr. David Thompson. Be well.